Hi guys, this is Caroline Peregrino, psychiatric nurse practitioner out of California. I'm so sorry I've been out of commission for some time. We were traveling for a little bit and then came back, and after a vacation you need another vacation. So that's what happened. The jet lag really got to me. But I am back and I'm hoping to be able to post videos for you at least once a week, if not more, but we'll try to shoot for once a week. What I really want to talk about today is understanding borderline personality disorder, and I'm sure you've heard of it. It's called many different ways: Axis 2, BPD, borderline personality. There's just a lot of names for it, but clinically, diagnostically, it's called borderline personality disorder, and that's what I want to talk about today, so that you can understand what happens in the psychological, psychosocial, development of someone with borderline personality disorder. Also, this channel is specific to you, nurse practitioners, specifically psychiatric nurse practitioners, to empower you with tools, skills that you need in the workforce, give you the necessary information that I learned throughout my journey as a psychiatric nurse and now as a psychiatric nurse practitioner. So if this is something that you like to get more skills on, please make sure to subscribe to the channel, and I will try to post quality videos for you guys. Okay, so let's dive into the topic. So what is borderline personality disorder? So like what I said earlier, in the old DSM, which is a DSM-4, you would probably have heard people have said, or clinicians have said it, Axis 2. And Axis 2 just means that it's a personality disorder, a list of personality disorders. So if you guys remember, for those of you who are, been in psychiatry for a while, but for those of you who's just new in psychiatry, so DSM-4 before has 5 axes: 1, 2, 3, 4, 5, and that's how we diagnose, or that's how psychiatric diagnoses are made. 1 being, the mood, the psychosis, the anxiety disorder. 2 being personality, and 3, 4, 5 has a different category as well: medical, psychosocial issues, and also the global assessment of functioning being the Axis 5. So Axis 2, this is where you put either developmental disability or mental retardation, or the personality disorder. And personality disorders, a lot of them, right? But usually sometimes it's being used as, Axis 2, meaning, being the most common, which is borderline personality disorder. In the psychiatric field, in the medical field, if somebody says, oh, this patient is Axis 2 or borderline, then immediately the automatic thought is this is a patient who's described as difficult, challenging, has behaviors, manipulative, and all other negative descriptions attached to it, right? And I think sometimes that gets passed on, and it's like, okay, they're just seen as someone who may be just difficult and challenging patient. But there's a few things that I want you to understand about borderline personality disorder. And so borderline personality disorder, it's actually a very debilitating condition. I have seen patients who comes in with this challenges, and sometimes the borderline personality is actually a lot worse than their actual mood disorder. They have the depression, they have the anxiety, and because of the borderline personality, they have a really hard time coping with what they're going through. So that seems to be more activated. So I want you to understand that usually borderline personality is related to childhood trauma. It could be any sorts of trauma. It could be complex trauma. And 80% of those with childhood trauma have symptoms or may meet the criteria for borderline personality disorder. And that's what I want you guys to remember. 80% of those with history of childhood trauma would have borderline personality disorder. So I want you to remember that when these patients are having a hard time, with their behaviors, and it's because they went through so much as a child. And I guarantee you, if you see it that way, you will see it on most of your patients with either complex childhood trauma or a specific trauma growing up. If you think about it, childhood trauma disrupts a lot of normal psychosocial, psychological growth and development. And remember, as a child grow, if there was neglect as a trauma, there was abuse as a trauma, I mean, your little world as a child is your family. And if you're not given that attention that you need, if you're abandoned, if you're neglected, not given, the support that you need to grow as a person, then how are you going to trust the world to do that to you, right? And so I want you to remember that, as a child grows, they use that little family as their meaning of what the world looks like. That's why it's really difficult for someone with borderline personality disorder to trust people. You probably have seen it, and sometimes there is, some paranoia, suspiciousness, because they don't know who's going to hurt them and who's not going to hurt them, and more so, they're very fearful of being hurt. Emotional dysregulation is one of the primary symptoms that you would see, where they cannot regulate their emotions. If a situation happens, then it's either all hell break loose. Maybe it's a little situation in the bigger context of things, but to them it's like the end of the world. And it's just because it's hard for them to regulate that emotion. And there is that, emotional kind of reactivity where if you think about, a burn victim, I think this is something that was in the book called I Hate You, Don't Leave Me. Think about a burn victim, a burn person, right? A patient who's had multiple burns in their body and they're just healing, or they're still very kind of raw. A little blow of air, a little pressure, it's probably excruciating pain. People suffering from borderline personality disorder has the same type of reaction. So maybe a little situation, somebody said something, it may be taken out of context because they very emotionally sensitive, and they react either with rage, anger, blame, a lot of those things. And it also comes from, the all or nothing thinking. It's either you're good or you're bad. There's no gray area, or black and white, right? And if you're bad, then you did something. For example, a partner that were supposed to meet at a restaurant came in, 30 minutes late because of this, and then it would be taken as, you don't care about me. You didn't even, it would be taken kind of in a way where it's kind of out of proportion, because it's hard for them to emotionally dysregulate. And again, it goes back to that feeling of I cannot trust you, and either you're good or you're bad, and there's no gray area. There is a lot of self-esteem, self-image, self-identity issues or challenges. You will probably barely see anyone who thinks they are the best and the perfect person in the world. A lot of people with borderline personality disorder have very poor self-esteem and belief in themselves. Of course, not unless they also have bipolar disorder and they're in a manic state, then they could be euphoric. But for someone who is suffering from borderline personality, it's usually very negativistic towards themselves, and a lot of self-blame, like what I said earlier. So they have a tendency to hate themselves. They don't like how they react. They don't like how people treat them. They don't like, they just don't like pretty much sometimes everything about them. So anger gets turned either towards others and towards themselves. And so that's why you would see patients or people with borderline who cuts themselves or self-mutilates because they just don't like themselves. And sometimes they use it because they also dissociate because of the overwhelming, sensory kind of stimulation coming in. The other thing is, like what I said earlier, they have this intense fear of being hurt, and because they don't want to be abandoned, right? I think that's one of the criteria in the DSM-5 is the abandonment, the fear of abandonment, the fear of someone not loving them, the fear of someone just rejecting them is absolutely, huge, and that's where the paranoia, the suspiciousness, that's where the emotional reactivity also stems from. And so if you look at it those ways, then you will understand why it's difficult for them to really emotionally regulate. Ultimately, what happens is, for someone whose symptoms of borderline personality disorder are pretty significant and severe, it really affects a relationship. It's hard for them to maintain a relationship because of that. People tend to walk around on eggshells around them. It's hard to maintain a loving, long-term, healthy relationship. Sometimes they get into a domestic kind of abuse type relationship. They just suffer a lot. So treatment wise, there's as far as we know, there's no specific FDA approved medication for borderline personality disorder. But for the comorbidities like the depression, the anxiety, of course we can treat that, because if they already have severe depression, severe anxiety, PTSD on top of the borderline personality disorder, then it's a lot harder for them to recover and to really work on tools and skills. Dialectical behavioral therapy, which is DBT, is the primary treatment for borderline personality disorder. The only problem is there's not many people who are trained to be DBT specialists. It is a program, it's a very long program, a few weeks, and somebody has to be, really in contact with them throughout the program, somebody that they can call in the middle of the night when they're having a hard time or having a meltdown because of a situation, and they can be told, you can be taught skills. And those are usually private and expensive. So that's why it's so hard. I wish that there's more of us who could be trained on DBT and really actually implement it. I'm not like a DBT specialist, but of course, I think all of us have learned some of that in school. I do implement some of that with some of my patients, including the stress tolerance, sitting with the difficulty and the challenges that they're going through. Trying to help them emotionally regulate and staying in the moment, all of those things could be helpful as long as you remind them. One big thing is also being compassionate to themselves, because there's a lot of judgment that they put on themselves and a lot of pressure, and so it's really important to remind them that you're asking people to be good to you. You want people to be good to you, but it's so hard for you to be good to yourself. And that's why I think it's really important for our patients, for you to teach our patient to be compassionate with themselves. Because sometimes, a lot of people forget that, and someone with borderline personality disorder forgets that because of a lot of the self-blame. So I'm hoping that makes sense for you guys, and I'm hoping that you learned something new. Borderline personality disorder patients are not just, what we call difficult patients. They have gone through so much in their lives. That's why this becomes their way of coping with the situation and the way perceiving, the world around them. So I'm hoping that you'll be able to kind of understand more about this debilitating condition, really. Okay, so if you have any question, type it in the comment section. If you like this video, thumbs up, and if you would like to subscribe to this channel for more information or for more videos coming up, just hit the subscribe button. Also, let's see, I think that's it. So you guys have a good weekend and take care. Bye.